Okay, welcome everyone this evening. Appreciate your time being here. Tonight, this event, this forum, educational forum is brought to you by Sonoma Valley Community Health Center and Sonoma Valley Hospital. We are here to talk specifically about the COVID vaccine for pediatrics and for pediatrics. And then we are also going to give an overview of what is being considered or being proposed for a rollout plan of the vaccine here in Sonoma Valley. This presentation, our lead panelists are Dr. Sabrina Kidd. She's the Chief Medical Officer for Sonoma Valley Hospital. Joining her will be Cheryl Johnson, the Chief Executive Officer for Sonoma Valley Community Health Center, and also pediatrician for both Marin Health and Sonoma Valley Community Health Center, Dr. Jerome Smith. So we have a house full of experts here to address concerns from a practical medical point, also from a pediatric point, as well as the logistics in getting the vaccine into the community. I want to just give you some of the basic etiquette rules that we have here. Dr. Kidd will go through them as well, but we do have a simultaneous Spanish interpretation that's going on, a Spanish simulcast. This is being recorded live on SVTV, and I want to give a great warm appreciation to Bob Taylor and KSVY and his group for making this public access route available. And I thank you very much for that, Bob. Thanks. I also want to acknowledge we have two excellent Spanish interpreters working with us today, and they are Lorna and Ashley. And if you are needing or wanting to hear the Spanish, the presentation in Spanish, you can go look down on the lower right and you will see the interpretation, which is under the globe, and you can choose your language, English or Spanish. During the course of the presentation, questions that come to mind, please use the Q&A facility and also the chat. We will take questions at the very end of the presentation, and that's when the raise your hand feature will be working. And with that, I am going to turn this now over to Dr. Kidd and Cheryl. Welcome.
Thank you, Celia. We're happy to be here tonight. I'm Sabrina Kidd and happy to share with you what we know about the pediatric vaccine to date and some of the risks and benefits. And then I'll turn it to Cheryl to talk to you about some of the logistics. I'm going to start tonight with jumping right into how the vaccine works. I think really to have any conversation about a vaccine and about how well it works, we need to understand what it's actually doing in our bodies. I found that a cartoon explains that in a little bit more simple terms than medical speak and is helpful in having this conversation. So I'm going to play this and kind of narrate what it's representing as we go and then add a few bits to it. So this is representative of somebody getting the injection and going to our delivery to one of our cells. The cell then learns how to make a spike protein, which it coats us on, is recognized by your body as a foreign body. This then triggers the immune system and tells it to attack it, which creates an antibody response as well as other types of immune responses that are more long acting. That then has the body destroy all of those spikes that were created. And then it also teaches it to create memory so that later, when you encounter the virus in real life, when somebody breathes, coughs, sneezes on you, your body is already prepared to immediately put out the fire. It will attack those spikes, which are on the outside of the COVID-19 virus, and immediately destroy them, thus preventing you from hopefully getting an infection and at worst from getting a severe illness that could lead to death. So that's kind of a brief overview of what a vaccination does. It's basically tricking our body into what would happen naturally if we got COVID-19 without having to go through that severe illness. It's creating a very similar immune response. It's multifactorial. It is antibodies plus other things, which are T cell and B cell mediated, which is more long-term and creates memory as well. So with that in mind, how did we get to where we are today. Was this really developed at the start of the pandemic back in March of 2020? Was it really brand new and, you know, come to life in about 9 months? No, this was made possible after over 60 years of research is the reality. Back in the 1961 was the first discovery of what we call mRNA, which is the set of instructions that are used to tell our bodies how to create a spike protein. It's a synthetic version of that, and it took years and years and years to figure out how to make this work. The complexities were not really because this was dangerous. It was more because mRNA is very fragile. And it took a long time to figure out how to develop a coating, which is made of fat particles that would keep the mRNA intact and make it deliverable to our cells. That was a lot of what this research was about. The other big delay is these weren't thought to be profitable. And we know that our society works on an economic endpoint. And if there isn't a disease or a reason to develop the technology, there's not often a lot of funding to it. COVID-19 was the first of a family of coronaviruses that posed a significant enough risk to really take the research that had already been done to market. And that is why we saw things so quickly ramp up. The research was basically sitting there done, and all that needed to be added to it was an exact code for something that could mimic a part of the actual COVID-19 virus so that our bodies would learn how to attack it and prevent us from getting infected, or at least from a severe illness. So those are kind of some of the key steps in this very long process that made bringing the vaccine to market, first for adults back in late December of 2020 possible, only, you know, less than really about a year after COVID-19 was first noted in the world. So what about kids? Well, it's where we really want to focus on. And to get there, let's talk a little bit about what we know. We'll be focusing on the Pfizer vaccine today because that is the one that has the largest degree of authorizations at this point, and is the one that is going to be currently available for children. There is full FDA approval for the Pfizer vaccine for those that are 16 and older. There's something called emergency use authorization for all other COVID-19 vaccines at this time. And let's talk a little bit about what an EUA authorization is. That means that this has not gotten full FDA approval, and to many that may seem scary. It may indicate that steps were skipped in the process. That is not the case. No steps were skipped in the process or in bringing these to market. They were fully studied, the same stringent protocols and restrictions and reviews that would be done otherwise. The big difference is longer term data. So with an EUA is when it is very clear without a doubt that the risk of delay is much greater and the benefit, the benefit highly outweighs the risk of delaying and waiting for that full timeline. So these were the difference being that we don't have as long a follow-up from our studies. That being said, they're not thought in this case that follow-up will significantly impact any outcomes. So this is kind of a unique situation. So an EUA approval in this case has the same safety profile really as the full FDA approval in many aspects. So for the 5 to 11-year-old was what we're now looking forward to. And on Tuesday, October 26th, the FDA Advisory Committee met, and their job is to review that data package, not only what Pfizer submits, but any additional data that may be available to them, and with a critical eye to challenge it and see if they think the risk benefit is there and that they should approve this and indicate it for all. They did do that, and we now have that it has been recommended to the FDA for EUA approval. We are waiting eagerly within the next couple of days that actual EUA approval from the FDA. From there, it is anticipated to go to the CDC Advisory Committee, which is the next step. That meeting is set for November 2nd and 3rd. If it gets approval there, it will then go on to the head of the CDC for final recommendations. At that point, living in California, it will go to the West Coast Advisory Panel. And then once it gets that endorsement, it will be available to be given in California. All of that is anticipated to occur sometime around November 8th is the best guess to a date, depending on how these next few steps pan out. What about the younger children? Those studies are in process and nearing completion. We recently learned that we anticipate Pfizer to go to the FDA for an EUA approval in early 2022 with the results of that study. The under 2 is also in process, but it will be behind the 2 and up. So we don't have quite yet a projected timeline for that. But all of these studies are currently in process with Pfizer. And it is all the same vaccine. It's the dosing that is changing between studies, and a lot of attention to the dosing and side effects. So what do we expect from this? And this information is based on the information that the FDA reviewed to recommend the EUA approval. And this is from the Pfizer study itself. It is publicly available, and we will share this information or the link to it in our resources at the conclusion of this. So in the adult and older children, we were using a 30 microgram dose. In the 5 to 11-year-olds, although several doses were initially tested, they settled on the lowest dose being effective and having a very acceptable side effect profile. This is a 10 microgram dose. It is 1/3 of that of the adult dose. It is still 2 doses given 3 doses apart, or 3 weeks apart for the primary vaccine series. It has actually, most of the studies indicate that at this dosage, the side effect profile is more favorable than some of the adult dosing and some of the things that we've seen with Moderna. So there are very normal side effects, and it is an extremely safe vaccine. In this age group, they were seeing that most side effects lasted 24 to 48 hours and were quite mild. Very common ones were some pain at the injection site, redness and swelling, as well as more common fatigue, headache, and chills. Less common but noted were actual fevers, muscle pain, or joint aches. Of note, there's been much talk about the side effect that was seen mainly with Moderna and mainly in older teenagers and young adults, and largely males, of myocarditis and pericarditis. In this study, which was 1,500 individuals who actually received the vaccine, not including those who received a placebo, there were no cases of myocarditis or pericarditis to date. The study goes out at least 2 months, in some cases longer, but it's a minimum of 2 months with all individuals involved. And of our experience to date with the cases that have been noted outside of this study, they're usually occurring within 7 days of the vaccine. So we would think that that is a fairly adequate time period. That being said, when extrapolated to a larger group, it is yet unknown if there would be a rare case of myocarditis to pericarditis. And we can talk more about that later, but most of those cases are very mild and are treated conservatively. So what about how well this works? In those ages 5 to 11, they are quoting a 90.7, so basically a 91% efficacy rate in preventing symptomatic infection. There were no cases of severe illness amongst those who received the vaccine. And of those who had received the vaccine yet still did have an infection, those infections were much more mild in nature compared to those who received the placebo, the unvaccinated group. So really this comes down to risk versus benefit. Yes, I know there's a lot of questions out there about what about long-term evidence and long-term side effects and theoretical concerns, and there are many. And what I can say is that we have known very severe symptoms and results and sequelae of COVID-19 infection. And for the vaccine, we don't have any of that. It's all positive information with theoretical long-term concerns, which science hasn't found a mechanism to back up. So it's really risk versus benefit. If you get the COVID-19 vaccine, we know you're looking at the possibility of mild side effects for 24 to 48 hours in most cases. However, a COVID-19 infection, you're risking a possible severe illness, and that could be anywhere from a day to 21 days to much, much longer in some cases. We do know that the mRNA vaccines, not as much in this study as we talked about, there are rare cases of inflammation around the heart, myocarditis or pericarditis. This is very treatable, and most cases are mild. There were no cases, as I said, in this trial, but we know that if you get a COVID-19 infection naturally, you are at least 6 times more likely to get myocarditis or pericarditis. So there's a definite known severe risk, and not all of those cases are mild. We also know that with the vaccine, we've seen no long-term side effects to date in either the adult or pediatric population after millions of doses worldwide. But we are seeing long-term effects of COVID-19 and even near-term severe effects in something called multi-system inflammatory syndrome C. There's been about 2,600 cases of this in US kids ages 5 to 11 to date. That is severe inflammation that affects their organs and can lead to permanent damage in some cases. There have been no deaths that have been definitively linked to a COVID-19 vaccination. And while there's been reports of deaths after people have received COVID-19, there's been no causation to date from it, meaning that the death had another reason, even though it may have been time-wise related to giving the vaccine. However, we do know that in children, although it is rare, there have been about 150 deaths in this age group in kids. And COVID-19 now ranks amongst the top 10 causes of death for kids in our country. So this numbers may seem small, but given it's in the top 10, I think it's pretty significant. Also, let's talk about the ability to infect others. We know that that's definitely decreased with COVID-19 vaccination. However, if you have an infection, we know you're still putting all those that you're around and your loved ones at risk. So your ability to infect others remains high. There's been a lot of questions about, does this affect fertility? Does this affect menses? Does this affect women's reproductive systems in any way? There is no evidence that this affects that the COVID-19 vaccination has any effect on women's reproductive health. And there is no reason, there have been no vaccines throughout history that are known to have this. So there's not a mechanism that is theoretical for this as well. We do, however, know that COVID-19 infection has been now documented to have negative effects on both pregnancy with a higher miscarriage rate, as well as the possibility for preterm deliveries, and thus negative effects for the child as well. So really it does come down to known versus unknown and risk versus benefit. So let's talk about some of the other myths that may be out there. First off, the vaccine can affect my DNA. Why is that not true? This is not something that is at all related to DNA. It's mRNA, which is a synthetic portion. It's not a live virus. It is basically a set of instructions that teaches your body how to make the spike protein so it can learn to attack that spike protein. So it has, it doesn't have any ability to interact with your DNA in any way. And further, our bodies destroy that set of instructions, or the mRNA, once it has done its job. So myth number 2, a vaccine developed so quickly can't be safe. They've undergone the same rigorous testing and external review as anything that would have full FDA approval. So these may seem new, but as we discussed, they are based on research from many, many years that has been thoroughly tested. So myth number 3, the vaccine can give me COVID-19. So the mild side effects that we've discussed, those are signs that your immune system is working and creating an immune response. Although they may mimic in some ways what a mild cold would feel like, they are in no way representative of giving you COVID-19. It is simply your immune system going to work to protect you from future illness. Myth number 4, the COVID-19 vaccine can affect my fertility. And as I discussed before, there is no data to suggest that these vaccines pose a risk to someone who is pregnant or who wants to become pregnant. But we do know the significant risks of COVID-19 to those who are already pregnant. Myth number 5, I don't need the vaccine because I've already had COVID-19. So we do know that depending on many factors, including the severity of your disease, which is not necessarily a direct correlation, there's many other factors, that you develop some level of immunity after having COVID-19 in most cases, not 100%. But we also know from studies that the degree of immunity you develop is unpredictable, and at this time not measurable. Antibody levels are not necessarily predictable of your ability to fight off the disease. There's many factors that go into this. Therefore, because of these unknowns and the fact that we've seen many people who have had COVID-19 documented get secondary infections, it is recommended that all people get a COVID-19 vaccine regardless of whether or not they've actually had COVID-19. The most powerful immunity we think you can have at this case or at this stage is natural immunity plus a vaccine. So it really helps you fight off future illness. And as data is coming in, we're seeing more and more cases that natural immunity may in fact wane over time, and that the vaccines can significantly bolster your immunity. So myth number 6, I don't need the vaccine because I'm young and healthy. So as we saw, that there really haven't been a huge number of children who have died, although it is in the top 10, numbers-wise, it may not seem impressive to many people. However, we know that even mild COVID-19 can cause uncomfortable and or lingering symptoms, or even very severe things such as hospitalization and in rare cases, death. We also know that, as we talked about, vaccination helps decrease transmissibility. So you're contributing to the public health goals and protecting not only yourself, but anyone who is around you who may not be able to fight off disease well, or may be elderly. So you're protecting those you love, including your parents and grandparents and siblings as well. Myth number 7. I don't need to wear a mask after being vaccinated. Well, until we get to that point where case counts are low enough altogether, wearing a mask really does help us. And that way it does is it decreases transmission as well. That's very important because when we keep the number of cases low, we prevent the virus from mutating. And if the virus mutates too much, we risk the chance of it becoming resistant to vaccines. And that's having to kind of start all over with our vaccination campaigns and with our science developing a one that would work against that strain. So really, we have windows in which we really need to get to a threshold in order to keep case counts low permanently and or eliminate this. So what about the religious stances on this? There's been a lot of concerns about these vaccines and the fact that both Pfizer and Moderna in their testing, not in the vaccines themselves, were tested on a historical fetal stem cell line. This same fetal stem cell line is used in almost every common medication out there, including most over-the-counter medications. There has been widely known a list of the 30 most common medications, and nearly all of them were tested in the same manner as the Pfizer and Moderna COVID vaccines were. These include acetaminophen or Tylenol, ibuprofen, also known as Motrin or Advil, and Benadryl. So very common medications that we all deem to be very safe and take regularly were also tested in the same manner. As I said, no fetal stem cells are or were used in the production of these vaccines. In addition, no pork products are used in the production of the Pfizer or Moderna vaccine as well. I'd also like to state that nearly every major religion has come out saying that despite any religious beliefs, they are in favor of everyone getting the vaccine. So it's a very clear statement from many organizations that the benefit outweighs any risks or religious doctrine. So what is our game plan to keep our schools open, to keep our families healthy, to get back to what we consider normal lives? Get vaccinated. And while we're working towards that, it's very important to continue to wear our masks. So with that, I would like to hand it over to Cheryl Johnson from the Sonoma Valley Community Health Center to talk with us a little bit about the logistics of rolling out the vaccine in Sonoma.
Thank you so much, Dr. Kidd. Again, my name is Cheryl Johnson. I'm CEO of Sonoma Valley Community Health Center, and we will be helping to administer these vaccines at the schools. Currently, we will be vaccinating at 6 locations: Dunbar, Sasserini, Altamira, Flowery, and Adele Harrison. What we're hoping is that we would have these sites available and that we would invite other schools to participate if they were either co-located or nearby. So while Dunbar will only have Dunbar parents and students at their site, Sasserini, we would invite St. Francis School. At Altamira, we would invite Willen Star. At Flowery, it would be Sonoma Charter. At Adele Harrison, it would be Presentation and Presswood, and so on. We're also looking at potentially doing some other sites as well. So we're talking about starting vaccination as soon as November 12th. That gives us a little bit of leeway to get the vaccine in place, as well as to get the vaccine here. So as I believe Dr. Kitt mentioned, the vaccine is actually not physically at any location. It is not going to be placed at locations until after the CDC makes its recommendation. So there will be a kind of a period of time between when the CDC makes its decision and when the vaccine is actually available. When we vaccinate at the schools, we will only be offering Pfizer, even though we'll be offering Pfizer to both adults and to children. And this is to ensure that we are providing a safe environment as possible. So we'll be focusing in on Pfizer. At some of the pop-ups that we currently do, we're offering flu vaccine. And at Dunbar, Sasserini, Altamira, Flower, and Aldale Harrison, we will not be. So the only vaccine that we'll be giving will be the COVID-19, and the only manufacturer we'll be giving is Pfizer at those events. Each of those sites that we're looking at, the vaccinations will occur between the hours of 4 p.m. and 6 p.m. And then we'll be returning to those schools in 21 days to provide second doses. In 2022, we will also be looking at doing another round of vaccinations at the schools, and hopefully at those same sites that were mentioned beforehand. And again, what we're really looking at is providing access to vaccinations for those people who want them. And then if we could look at the next slide, I will, again, we kind of already said this before. We're going to be offering the Pfizer vaccine only. Families are welcome to be vaccinated if they choose to. And there is a round 2. So if people are either wanting to wait or are unable to be vaccinated in the time periods that we're looking at, which is essentially from November 12th to December 13th, and then we have to go back to one of the schools on January 3rd, there'll be another opportunity to get vaccinated if they care to at the school sites. So, you know, we're hoping to roll this out. We're hoping to have educational events, and hopefully people will feel that being at some place that they know the people that they're familiar with will be helpful to them. So we're really trying to reach people where they are. We will not be doing a mass vaccination site like we did at Betts Hall previously. So that's what we're looking at right now. Most of the dates that are on the slide are tentative, but we're working hard to get this done. And we're working with not only our partners in Sonoma Valley Health, Sonoma Valley Hospital, Sonoma Valley Fire Authority, La Luz. We're also working with the county and the County Department of Public Health, as well as the Sonoma County Board of Education to get these things done. So there'll be more information coming up, but it looks like we'll be doing this as soon as November 12th.
Excellent. Thank you, Cheryl, so much. So we have here some community resources, but before I get into those resources, I'm going to go back to Cheryl a little bit. Cheryl, can you tell us what happens when, what needs to happen ahead of time when you arrive at a site? So let's say that I'm going to go to the Sasserini. I'm a parent with a child at St. Francis, so we're going to go to Sasserini. So can you just walk me through what that process is going to be like?
Sure. So the one thing I will tell you is that, you know, obviously you can make an appointment through My Term, and that should be available as soon as we get confirmation of the dates. But we will also be asking you to fill out paperwork in person. And the reason why we're asking you to do that is because of the fact that we want a little bit more information, and we want to have a parent or guardian signature for authorization to give the vaccine. At that particular time, after you do all of that, there'll be an opportunity to provide more education. So if you have any questions or anything like that, that would be a great time to do that. One of the things that La Luz will be offering is they'll be offering what we call vaccine navigators. And so if you feel that you would want somebody to stay with you, they would be one of the people who will be able to do that and again, provide more answers, and because they are trained to do that. And then typically what we do, we're doing these indoors. So we'll be sitting you in a pod that's socially distanced. Your shot would be administered. And then there's a 15-minute wait period. And so during the course of the 15-minute period, we're really looking for to see whether or not the student or the client is taking to the vaccine well. And if they're not, then we'll provide assistance. During the course of that 15 minutes, we really do recommend that people bring something to do, whether it's a cell phone or a game or something like that. And it's really, really helpful. After that 15 minutes, we give you your immunization card, and then you are on your way. It is a little bit longer, 30 minutes for certain people, depending on how they answer the health questionnaire, because one of the forms we do have people complete is a health questionnaire. And if you answer some of the questions in an affirmative way, we would have you wait 30 minutes instead of the 15 minutes. And then at the end, we'll give you information on what to do if there is a side effect or something like that. But again, it's relatively mild in terms of site injection, redness, soreness. There may be a mild fever, there might be body aches and pain. But most of it is pretty similar to a mild case of the flu in that particular instance, and can be taken care of by over-the-counter medication.
Cheryl, thank you so much. That was wonderful. So Dr. Kidd has pulled up a screen called Community Resources, and here where you can go and get some additional information about the sites and locations are going to be provided by the sites at Sonoma Valley Community Health Center, Sonoma Valley Health Partners, also the hospital. We're going to be getting information through the city of Sonoma. Sonoma County Emergency, their website provides information in English and Spanish that explores questions that people may have about the vaccines themselves. You can also learn about testing and general emergency preparedness at this site. It's a very well organized site. If you're looking to schedule a dose, there is a website, myturn.ca.gov, that you can go to. And then, you know, we do get often calls, people saying, I need a copy of my vaccination record. There is a website where you can go and you can complete an online form and where you can obtain the information. UCSF, University of California at San Francisco, also has a lot of current resources and information about the virus. With flu season coming up, all of these sites serve to provide information about that as well. Dr. Kidd, did you have any more on the community resources before I get into the Q&A?
No, thank you.
So we received many questions ahead of time, and most of the questions, I believe, were covered in the presentation. Some of the questions are specific to schools and protocols that they will be using, and their governing boards will be asking their campuses to follow. And some are also very specific to the Department of Public Health. I'm going to be placing some links in the chat. One of the links is, there was a common question that people are asking about the application that Pfizer provided to the FDA, which also includes risk and benefit information. So I'm going to be putting that into the chat, so you can go to that link and you can find it and you can follow that. And I'm going to do that right now for everybody to be able to see that. So there's that right there. It is a PDF document, which you'll be able to open up, and that will get you to where you're looking for some specific information that might help. Another link, which is full of lots of information from not only research, but the most current information that has been out since in the last couple of days. And this is from the CDC, which is the Center for Disease Control. And this is specific to the pediatric COVID vaccine for children 5 to 11 years old. There are a lot of questions in here that are answered for parents, and I encourage you to check out this resource. And again, I have placed that in the chat, and you can see that in the chat area. Some of the questions that we received, and I will raise those right now for Dr. Kidd, for Cheryl, and also for Dr. Smith. Common question was, what if children are currently taking medications? What will the effects be?
So I would encourage anyone who has concerns about a specific illness to discuss that with your child's medical provider. But overall, I want to emphasize that the vaccine is not a medication. So a lot of times we talk about the concern and of interactions between unknown medications. The vaccine is not a medication in that same way, and therefore there's no really widespread known guidance that it would interfere with any medication. So this really shouldn't be an issue, but if you do have a specific concern, I encourage you to address that with your child's healthcare provider. And Jerome, do you have anything to add to that, Dr. Smith?
No, I would agree with what you said. We've given lots of other vaccines that are not mRNA vaccines, and almost none of those react with any common medications. If you're on some very specific immunosuppressive medications, or you're undergoing chemo or something that is probably beyond the purview of most of our listeners tonight, then yeah, you obviously have to talk to your pediatrician, your specialists, and see what their opinion is.
And Cheryl, if maybe you can help weigh in on this, if someone does not have a primary care provider, what resources are available for these people here in the Valley?
Celia, that's a great question. So obviously, there's two things. Number one, they can come here to Sonoma Valley Community Health Center and they can receive services here. And obviously, there are other community health centers in Sonoma County that they could also go to, in Illinois Health in Napa. You also have private pediatrician offices. I would say at the Community Health Center, we see a lot of Medi-Cal patients, and we will enroll people on the Medi-Cal. The other thing I would like to point out to the person who asked the question is that in the case you do not have a primary care doctor and you come and you present your child to be vaccinated and we have questions, we have providers on call that we contact, and we make sure that we get any questions that we have or that you have answered before we administer anything. So we know what's kind of normal, and we will vaccinate normal. On abnormal, we will stop and we will ask.
Great, thank you so much. Another question that we received, and for those that are having problems with the link I provided, I just provided it again to the CDC site, and I soon will put the link again to the PDF that you can download on the specifics of the Pfizer application itself. So another question is, what if children have had COVID, and do they currently have natural immunity because of it?
Yeah, happy to touch on that. So as we discussed a little bit, the amount of immunity from any COVID-19 vaccine infection is very unknown. In some instances from the studies we have to date, it seems to be robust, and others pretty much absent. We do know that in increasing numbers, people who have had COVID-19 as time passes may be susceptible to getting it again. We also know that as more variants arise, that may also add to you getting COVID-19 more than once, and the effects could be very detrimental. So for those reasons, it is advised that anyone and everyone, regardless of their whether or not they've had COVID-19 illness, receive the vaccine. There are some timelines to be considered if you had severe disease, and that you should discuss with the provider that treated you during your illness.
Dr. Smith or Cheryl, anything to add to that?
No, I think that Dr. Kidd has really touched on the two main points. One is that we can measure antibodies. It's a snapshot. We don't know how those will be in 3 months. And we don't even know if any specific level of antibody actually represents full natural immunity. So it's been tricky, and tricky for scientists as well. This virus has thrown us for all kinds of loops. We wish we had every answer to everything. We're doing the best we can. And so the recommendation at this point is to do the vaccine in hopes of sort of really stamping it out and avoiding a 7th and 9th and 11th wave and mutations on the way that makes it an even tougher thing to control.
Thank you so much. Cheryl, here's a question for you. Well, probably for you or for Dr. Kidd. One of the questions that was asked ahead of time is, will the public have access to the percentage of Sonoma County 5 to 11-year-olds who received the COVID vaccine?
I can say that all of that data to date is available on the Sonoma County Emergency Preparedness website. I believe it's SoCo Emergency, something of that nature. Celia can help me. But it's, if you look on the Sonoma County website and or CDPH's website, the vaccination rates for various geographical areas are all reported and updated regularly. The New York Times also keeps a registry, as well as several other organizations.
Cheryl, anything to add to the data collection?
No, except for the fact that I will tell you that we provide data to both the state and the federal level on a weekly basis. So the data is there. I will tell you that there are the county also has vaccination rates by census tracts that go into a little bit more detail. And so I think it's also at the same website that Dr. Kidd mentioned.
Thank you very much. Also on the call, we have in the audience the principals from the various schools here in the Valley, including Presentation, St. Francis Solano, Sonoma Charter, Woodland Star Charter, Sonoma Valley Unified School District. I'd like to just thank them for being a part of this call. The questions that we did receive ahead of time that are specific to the schools, we will be sharing that. We'll be sharing that information with you. We'll now go to taking some questions from the audience, and we're looking for. You can go place your question in the Q&A or in the chat. Do we have any questions from the audience at large? I see a question in the chat. Can you frame your question, please? Okay, we go. All right. There's a question that's being asked. They're looking to find out if there will be any exceptions for religious beliefs.
So at this point, we are here to share the medical information, and I'm not in the regulatory business, nor can I speak to any governmental mandates or school mandates at this stage. So we're going to have to wait and find out.
I would say that on the topic of mandate, which obviously gets a lot of people very passionate about this thing and sort of kind of clouds the discussion, that at the very most, the news is that if there is a mandate, it's going to be after the vaccine receives full approval in the age group. And that's not projected to happen for months. So for people who have that immediate concern, I don't think you should have that immediate concern. There is also a possibility that the CDC may put a box around which kids get the vaccine. And if there's any sort of things on that front next week, you'll probably see people walk back 100% mandates. I think they are planning for certain exemptions, but again, I'm not a government official either. You'll have to follow the news, the developments like the rest of us do.
Thank you very much, Dr. Smith. We do have a question that was placed in the chat, and if a parent is concerned about any adverse reaction that they may have from this EUA injection, and they want to know what recourse do they have?
There is national reporting for all vaccines, not just unique to COVID-19, and that information is provided at the time of vaccination and is widely available on the internet and other sources. And we would encourage all, if there was an unfortunate event, to work with their medical team first and make sure that events were reported to that national registry as well.
Thank you. I'm sorry, let me rephrase the question. If my child suffers an adverse event from this experimental injection, what recourse do I have? That was the concerned parent. I think that it was addressed.
Again, we're not policymakers or lawyers. I know that you can report any adverse events to the Vaccine Adverse Events Reporting System, which is VAERS. And there's also a plan, I think, to widen the scope of the V-Safe. Any of you adults out there that have gotten vaccinated know that some of you get those texts from CDC periodically after your vaccine, and they're planning to do that with the kids too, I think.
Thank you, Dr. Smith. So I have another question that came up in the Q&A. And this question is, will kids whose parents choose not to get them vaccinated still be able to attend school if testing is done regularly? Dr. Kidd or Cheryl, either one of you want to take this?
Those are questions we can't answer. I think they're policy decisions that are yet to be made and by individuals that are not present on this call.
Okay, thank you very much. I have another question. A 5-year-old at 45 pounds and a 10-year-old at 100 pounds, same dose, is one shot enough for the smaller kids?
That is a great question. An interesting fact I actually learned recently as I was brushing up on some of the kids' vaccine information is vaccines are age-based. Vaccines are not weight-based. So they are based on the immune system's response, and that is predictable across age groups. And so the weight is not important. A lot of people have asked, should they, if their kid is bigger or smaller, should the dose be varied? No, it's based on age group, and that's why the groupings are done this way. And Dr. Smith, do you have anything to add to that?
No, I think in the Pfizer study, 5 through 11 were pretty equally effective. So you might then ask, if it's age-based, what do I do if my kid's 11 and 10/12ths? And I'm hoping that the CDC will give us a little bit more advice on that, because obviously if you're close to turning 12 and your dose is 1, but if you're the week before and your dose is a third of that, what should you do? We are also looking for that guidance and hoping to have some clarity on that before the rollout.
All right. And I can tell you, based on the calls that I've attended, that the general belief is that you should go by the age. So if they're 11 and they're going to be 12 next week, but they're 11 when they get the shot, then they should be getting the lower dose. So, but we'll find, the thing I will tell you in the course of all of this is the fact that there has been changes, and we've made adjustments based on more information that we've received. So it's the way of the pandemic right now on all things.
Thank you, Cheryl. I have another question. They may have missed it. It may have been talked about in the presentation, Dr. Kidd, but they're asking, I may have missed this in your presentation, but are you aware of any further or follow-up results expected from Pfizer trials on the 5 to 11 age group?
Yes, all participants are continuing to be studied, including the very original adult participants. So these are turning into very long-term studies. Some of that data is included when you reach full FDA approval. So that data was submitted for the adults back in August, as you remember, and then in early September, that is when the FDA granted full approval for those 16 and older. So a similar process will play out for all of these, and it is basically nonstop data acquisition and released in clumps. So I don't have exact dates for that, but as I watch these things lately, nearly every week a new additional information comes out, and the major studies are coming out, a little less frequently. But yes, all of these patients will be followed long-term.
Thank you very much.
More are added to it as well.
Thank you very much. Do we have any other questions from the audience? Again, we're just raising concerns for parents. These are parents who are looking to get their children vaccinated and just want some additional information or clarification. We did provide 2 links that were often asked for in the pre-questions before the forum began, having to do with the risk and benefit portion of the application that Pfizer submitted to the FDA, and also information that CDC has at a website that has a lot of detail, a lot of information that is very useful for the pediatric vaccine for those 5 to 11 years old. So I have here, just to be clear, another question came in. Just to be clear, you are informing us on what the benefits and myths are on the vaccine. So we don't have any information on what specific mandates will be for particular age groups yet, correct?
That's correct, we don't.
That is correct. We do not have any specifics at this point. All we know is what has been publicly released in the press, which is very little.
Another question that we have is, will the pediatric offices offer vaccines? And I'm going to add on here in Sonoma Valley.
My office will be getting vaccines. We may not have it as early as the health center rollout, and I'm not sure about the other pediatricians in the Valley.
Great, thank you. And thank you for those great questions. So we are putting together the questions and the answers based on what we have received and what we have here tonight into a central document that we will be sharing with the schools and with the Sonoma Valley Community Health Center, so that we'll have that information available. If you think about something and you thought, oh, it wasn't covered, or maybe you may have missed it, we will be posting both a copy of the recorded copy of tonight's presentation, along with a copy of the presentation itself in a couple of days at the hospital's website. We hope to share this with Sonoma Valley Community Health Partners site and also with the Community Health Center. Sonoma Valley Hospital's website is sonomavalleyhospital.org, and you can go to our COVID section and you'll find the information will be posted there perhaps by Monday for this seminar. On Wednesday, November 3rd, we will be doing this presentation again, only in Spanish with an English simulcast. So if you know people that want to participate or may have missed something, or are English is not their first language and it's easy for them to understand in the Spanish, then that's what we're going to be doing on November the 3rd. You can always send an email to me and I will follow up with you. My email address at the hospital is community@sonomavalleyhospital.org. That's community@sonomavalleyhospital.org. And also you can call my office at 707-935-5257. I do have one more question that came in, and the question is, if you're to inform us of the risk and benefit, you should be less vague about natural immunity. It is a full cop-out to deny that natural immunity is in fact immunity. I don't know if Dr. Smith or Dr. Kidd want to take that.
I mean, I think a natural immunity from one virus is different from another. Coronaviruses, historically, the 4 that are not COVID-19, are common cold viruses. And you may have natural immunity for a few weeks to a few months and get the same cold next year. Versus something like varicella, you get chickenpox, which are not again for your life. So I think it's not because we're trying to be coy about what is natural immunity. It's different things at different viruses. It's different things to different people's immune systems, depending on severity of disease, depending on timing. So there are just a lot of variables. And that's, I think, why we would love to be more specific about everything. And some things are just variable. And we know with certainty that they're variable, and that's as far as we can get.
Thank you very much, Doctor. So looking ahead, we will be, actually, Dr. Kidd, if you don't mind, can you go back to the tentative rollout dates that Cheryl had? I do have some questions that's being asked. Would you please repeat the tentative rollout dates for both November for the first dose and December 2nd dose? And if you have a specific question about this proposed rollout, you can go ahead and ask that. Cheryl, do you want to elaborate a little bit more on the tentative school vaccination sites?
Sure, I can. So, we tried to pick school sites that were throughout the valley, and hopefully we were able to do that. And even though we may invite a school, such as with Sasserini, we're inviting St. Francis. If you are attending Sasserini or St. Francis, it doesn't necessarily mean that you can't go to Altamira or Flowery or Adele Harrison, for instance. And again, I just want to reiterate, that we're making this available on these particular dates, and the second date will be 21 days later. And I know that these dates are coming a little bit fast. We will not be vaccinating the week of Thanksgiving, and we didn't vaccinate on November 11th because it's actually Veterans Day, and we were told that people actually had Veterans Day off. We will be setting up a second round, which will include the first and second dose in January. But right now we're trying to get these first round out, and then we will let people know when the second rounds will occur. And that will be found on the Sonoma Valley Partners website once we've determined those dates. And the school district has been pretty phenomenal about helping us get this done. And they, for those who are in the public school system, they will be using Peach Jar to announce the dates as well.
Thank you very much, Cheryl. It has come up also in the chat, just to stress again, that parents and guardians must be present. And Cheryl, can you just elaborate on that a little bit more, please?
Sure. So in the state of California, we cannot provide vaccinations for people under the age of 18 unless they have a guardian or a parent present as well to sign off on it. With certain kids who, let's say, for instance, that you are wanting to get your 5-year-old vaccinated, we would actually probably ask the parent to participate in the vaccination to ensure that the child is comfortable and that the child remains in place. So we really need to have people there, and we do have to have for our protocol, we're requiring a wet signature from a parent or a guardian to say that, yes, they agree to have their child vaccinated. In some instances, we might take a phone call, but it has to be in a circumstance that we fully understand where we would take a phone call. The general preference is for the parent or guardian to accompany the child.
Okay, we've got a couple more questions and then we're going to be wrapping it up for this evening. I have another question that's going back to the school sites. I'm being asked, in addition, why are you using elementary schools at vaccination sites?
That's a great question. We're using elementary schools because of the fact that the elementary schools have the age range. So they have the largest age range. I will also point out that we're doing middle schools, as Adele Harrison and Altamira are middle schools.
Thank you so much. Another question for Dr. Smith. The questioner asked, that Dr. Smith said that it would take months to approve, but you are now vaccinating on school campus in the next month. Please clarify.
Yeah, happy to clarify that. So once emergency use, which is the first step in the approval, is okayed, we are allowed to vaccinate the kids. And so we make a plan to do that for those parents who are ready to do that. Full approval comes steps later. You saw that in the adults, in the adolescents, and there's a time lag there. The mandates and all the things swirling around the possibility of mandates are predicated on full approval of the vaccine, which requires more steps. That's not going to be happening next month as we get started with vaccinating on the school sites. I hope that clarifies it.
Dr. Kidd, anything to add on to that?
No, that's exactly, I mean, we're all waiting for that information as far as what the mandates and, any restrictions or things like that will happen. And at this point, we just don't know. What the state has voiced is that at this point, their plan is that nothing would take effect until there was full FDA approval for that age group. So 16 and older would be the only ones that have that at this time.
Okay, and then I have the last question for the evening is, what about drawing a titer for detecting immunity?
That would seemingly be a great thing to do. And a lot of people tried it and it didn't pan out, meaning that when we get results of antibody titers, there are a couple problems. One, those tests are also under emergency use authorization, as are most of our COVID tests, developed in the same time frame. So some proved to be very good tests and some proved to not be as good a test. But more importantly than the test being good or not, because there are some very, very accurate ones now available, we found that antibody titers do not correlate to immunity. So just because you have a high antibody response doesn't not mean that you are better protected from COVID-19. So even though those would seemingly relate, that is not what the experience has been in real life. And so there are many things to immunity. It's a very complex thing, immunology. There are many specialists just in that field, and there are many types of immunity that our bodies are wizards about. And so there are many other cells involved other than B cells creating antibodies. And so I guess for many of us, it's a simplistic view that we would love to just make it an easy answer. If I've got this titer, I don't need anything, woohoo, I'm done. And likewise, to know, do you need 1 dose, 2 doses, 3 doses? We yet have anything except real life experience to guide us in that manner. So unfortunately, that test doesn't correlate to the outcome.
Thank you very much for that. Well, I think this is a wrap for tonight. I am putting my contact information in the chat. Again, if you think of some questions at the, following this, something that comes to mind, please go ahead and send me an email. And my name is Celia Cruz de la Rosa with Sonoma Valley Hospital. I thank you all for attending tonight's session. Our goal is to have this session posted to the website early next week, along with a copy of the presentation that you viewed. We appreciate your time and attention, your concern, and the questions that you've raised. You've given us a lot to think about, and also we appreciate your diligence in keeping this, in reducing what we can do for the pandemic. Special thanks to our panelists, Dr. Sabrina Kidd, Cheryl Johnson, and Dr. Smith. I also want to acknowledge our 2 amazing interpreters, Ashley and Lorna, and again, the guy behind the mask who makes it all possible for us. Actually, there's 2 guys. There's Bob Taylor, who's doing the simulcast, and also to our wonderful Michael Kovacs. Appreciate you coming. Thank you so much. And please send me an email, community@sonomavalleyhospital.org. To your good health. Thank you for attending tonight's talk.